As a patient, you're probably only thinking about the day of surgery, but what you might not realize is how much work goes into before surgery and after surgery. Welcome back to Your Face Unfiltered. I'm Dr. Keith Ladner, double board certified facial plastic surgeon. And today we have a special guest for the first time. We have Portia, who is our lead clinical nurse and is the one that takes amazing care of our patients before and after surgery. So welcome, Portia.
Thank you so much for that introduction. Happy to be here.
I'm glad you're here. So we have Portia on the show today because we want our patients to really kind of know and I would say understand and appreciate how much goes in to the before and after care for our patients each time they have surgery.
Absolutely.
So we're going to start with some questions. What happens before a patient even gets to our OR that our audience may not really kind of appreciate?
Absolutely. Well, first and foremost, I am introduced into your life about a month prior to your surgery, where we review all of the prep for the procedure itself, as well as for the aftercare instructions. And that's when we really dive into any questions you might have leading into your procedure after your consultation with Dr. Ladner.
Perfect. And about how much time do you spend with our patients during that appointment?
It's roughly about 60 minutes. And so I spend a full hour dedicated to exactly what they need in terms of reassurance, information, as well as gathering your medical history to make sure that we're proceeding appropriately.
Yep. And assuming that this would be relevant for our patients, maybe because of age or pre-existing medical conditions, what else are you reviewing at that appointment and are you requiring before they hit the OR?
Absolutely. Dependent on comorbidities or anything that might indicate that we want a little bit of further information. Sometimes that's a visit with your primary care provider, hematology, endocrinologist, neurologist, anything dependent on your specific history, which is important for us to know.
Yep.
Following that, I just go ahead and make sure that the basics are met. You have adequate, stable blood pressure, your vitals are good, you're nice and healthy, because we want to optimize your results going into the procedure by setting you up successfully, and that begins with being healthy to start.
Yep, that's exactly right. So we oftentimes will perform labs in our patients. We'll oftentimes get EKGs. And then as Portia mentioned, if appropriate, we're also going to send patients to cardiologists, to primary care doctors, to number one, not only make sure that they're going to be safe for the procedure, that is first and foremost, but number two is to optimize our perioperative approach to those patients, right?
Absolutely.
And so making sure that we're doing everything we can to ensure kind of a smooth process. What are two things that you would recommend to all of our patients that are coming in for that preoperative appointment that are sort of like non-negotiable?
Absolutely. I'd recommend bringing someone with you. So a second set of ears is always helpful just to hear the information. It can feel a little overwhelming, and that's what we're here for, to support you through that process. But it certainly doesn't hurt to have that follow you home after the procedure as well. Secondly, I would say making sure that you know what medications you're taking, all of those things in terms of having me safely prepare you for your day of the procedure is also incredibly helpful. So whether that's a list or pictures, so that way I have appropriate guidance on how to direct you best for surgery.
And how about what can they do to prepare for the prepare? So in other words, prepare for that preoperative appointment.
Absolutely. I think we do a great job in sending you instructions, and there are a couple of attached documents to an email that you get prior to your appointment. And it is incredibly helpful to make you feel more confident going into that preoperative appointment by reviewing those. And even if you don't understand quite everything, that's exactly what I'm there for, to just reinforce exactly what you're concerned about / have questions for, and that's what we're here for.
Perfect. Okay, so we've done the preoperative appointment. We've gotten them completely repaired. They've done their work, right,
Yes.
which I think is equally important.
Exactly.
We go through surgery. Surgery's smooth. We're seeing them back for their follow-up appointments. Walk me through not just the follow-up appointments, but what are all the things that you do on a daily basis in terms of, again, optimizing that post-operative care for our patients? What does your day look like?
Absolutely. I think, excuse me, I think my day is partially being a little bit of your cheerleader
Yep.
slash being someone that I can reassure you of what's normal and what's not, because let's face it, there's really no baseline for a lot of the patients who have surgery with us unless
Yep.
they've seen a loved one go through that process.
Right.
It's something unique, and I think that there is something to be said about the psychological toll it takes on you in seeing yourself in the mirror. More than that, I'm also answering any questions you have in terms of medications, in terms of post-operative care, in terms of as simple as when's my next follow-up
Yep.
to, hey, I'm concerned. Do I need to come in for an appointment? In which I always make the time to see our patients.
Yep, exactly. So I think that what a lot of patients, probably don't appreciate, and nor should they until they go through the experience themselves, is how much interaction that they're going to have with, either you or our clinical PA. And that's going to include phone calls. It's going to include emails,
Yes.
right? Lots of
Text messages, photos.
clear messages.
We get really close.
That's exactly right. And so I think that there's a lot of underestimation in terms of how much Portia really does after these procedures.
Appreciate that.
Because it's not just those in-office visits, right, that are planned visits. It's the hand-holding and reassurance, right, that
Absolutely.
patients need after the procedure. So she's spending a lot of time really just being a patient advocate for all of our folks that go through these procedures.
Absolutely. I think that it's so crucial because you are so incredibly busy and in high demand. So I think that it's important that we have a little bit of an extension of Dr. Ladner himself. And
Absolutely.
I would go to say I think that Dr. Ladner does an incredible job in terms of being very personable with patients and of course a professional way in which he makes himself available. And whether you know it or not, he is always following your care, even if it's just in communication with me, because he's watching your photos. He is watching our text messages. He knows everything. He is the eyes in the sky, and he's always involved in your care. And so I think that I do my best to just be your echo in terms of what he recommends for post-operative care. And so he's always involved.
Yeah, well, thank you for that. I am a little bit of a stalker and a little bit obsessive and neurotic, but
In the best way.
But yeah, exactly. All for the best. And one final thing that I would add to this, and I think we oftentimes overlook this in terms of telling patients this, because maybe it's a little bit too much information to be totally honest. But I think one of the biggest benefits of having our surgery center on site is that I am accessible to Portia, accessible to Evangeline, our PA, accessible to our administrative staff. And so if there's ever a patient question, if there's ever anything that they need to run by me, they're not 100% sure, they just want confirmation that their plan is correct. They can literally come into the operating room, they can see me that day, they can ask that question immediately and get feedback and an answer to our patients right away.
Absolutely. I think that is something that I feel like I can uniquely speak on as being a huge perk in terms of having your own surgical
Yep.
center. I've worked at offices where you have to coordinate with different hospitals. The provider isn't exactly in touch distance. So it is so amazing that I'm able to go ahead and chat with Dr. Ladner and really pick his brain in terms of care, whether that patient is in the office or not. He always makes it a priority in terms of what's necessary and best for the patient. And so it is incredibly helpful to have you so close by. Incredibly happy that we have that surgical center. So definitely a perk coming here.
Yep. And I would say if I could summarize today's episode, Portia's amazing. If you look at our reviews, she is almost always mentioned in every single review because she is such an integral part of this whole process. And so I'm just only one component of optimizing those results, and she is a huge piece of that puzzle. So
I think you gave me some natural blush in that
there you go.
moment. Thank you.
So thanks
very
for being here
much.
today, Portia. If you guys like what you heard today, please be sure to like the video and subscribe to our channel.